I'm head of evidence and analysis at the Wahlberg Centre for Wellbeing. I have three things really that I'd like to share with you today. One is where we are now in the Wahlberg Centre, where we're headed, what we'd like to achieve, and why that makes us different, because I've been asked to speak to the topic of what difference will the new Wahlberg Centre make. And how can you be involved, and really you must be involved in order for us to do what we want to do and to achieve the vision. So really where we are now, we have lots of data out there being collected in lots of different ways, using lots of different techniques. So we have a huge amount of information. And we know quite a bit about what affects well-being. And we know how well-being contributes in some ways to other outcomes that we're interested in. But the evidence is really quite patchy in places, and the evidence base is spread out in lots of bits and pieces and little corners everywhere. And it's quite hard to compare like with like a lot of the time, to know actually, if we were to set them all alongside each other, what is it that we're looking at that would be the most effective approach? It's hard to get a coherent picture, in a sense. We also have an ongoing debate about how we actually define well-being. We could go on and on about that one, I think, for years to come, really. And some people feel it's kind of all things to all people at the moment, so it's hard to pin down and be sure that we're actually speaking a common language. And recently, the chief medical officer raised that in her annual report, noting that there are different measures used to assess well-being, and they reflect quite different ideas about what well-being is. And she said that our ideas and our evidence need to be clearer if we're going to use well-being as an important contributor to policy making and evaluation. We know already that people out there are spending a lot of time gathering evidence about what they're doing, whether that actually helps to raise well-being, or at least whether it helps to avoid any harmful consequences for well-being. And they really want to get it right. So that's what we're hearing already in the center. But practitioners and service providers, they don't always feel confident about the tools that should be used to measure well-being, how they can best measure it, how can they evaluate the well-being impacts of what they're doing, and how to do that most effectively, and then to share their findings with decision makers in a way that's clear and easy to understand and that can lead to action in a practical way. And even then, if they do know how, if they have the know-how, or they team up with others that do have the know-how, we're also hearing, it's also quite hard to convince people that hold the purse strings that you should spend the money to do the evaluation rather than putting it all into the service delivery. So then you're into a kind of slightly vicious circle of not having the evidence that's going to make your business case and really prove your point. So all of those things are part of the picture that we see in front of us now. Taken together, that leaves us with a lot of really laudable activity, which doesn't yet add up to a clear and coherent picture of what works for well-being, and where decision makers faced with tough choices about how to invest and where they will get the greatest benefit for their investment, know where to put that money. And even in terms of small tweaks, in terms of what we're doing on the ground when we're sitting face to face with another human being and really want to improve our practice with them, it's hard for us to know what to advise, what's going to work better than another initiative. So that's where we are now. So we have lots of information, we have lots of potential, and now is where we need to herd together lots of cats and lots of bits of information that's lying in corners all over the place. So the other day I had this amazing conversation with someone about where specific types of measures are held, and she's been gathering this information from all over the place and apparently has an absolutely enormous database of it, and who knew? Who knew? So I'm really excited about that. I think we're going to be able to get this together and share it. So what we're really aiming for here now is to get the best possible evidence of what works, how it works, why it works, in what circumstances it works, and then to present that in ways that make sense and suggest concrete action that can be taken to improve well-being. So that's the job of the Wahlberg Centre in a nutshell. The center is very new. It was just launched on the 29th of October. I think some of you might have been there at the launch. We have a small team of people who are on secondment to the Wahlberg Centre at the moment, who are starting the ball rolling. And we have at the moment 17 different funders from across government, a wide range of departments and the Economic and Social Research Council. And together they've contributed funding of about $3.5 million for the work of the centre over the next 3 years. We're currently hosted by Public Health England in our development phase. And our interim chair is Lord Gus O'Donnell, which gives us some pulling power, which is quite nice. But we're now moving into that longer term, how do we set ourselves up fully and properly as a coherent center? How do we start connecting with all of you people out there that are doing all this amazing work and need to be getting together between yourselves and with us and with people across other professional boundaries? So the center is currently in the process of establishing itself as a registered charity. Will be independent of government, and we're aiming to have the charity set up and legally established by the end of March. We'll be appointing a chair and a board of trustees, and we're currently seeking nominations and expressions of interest in those posts. So if any of you are interested, get in touch with us. We'd like to hear from you. We're in the process of commissioning the evidence syntheses already from academics along with the Economic and Social Research Council. And there are 4 evidence strands that we're focusing on initially. And I stress initially because well-being is such a wide-ranging thing and cuts across so many different areas that really we could look at it across many, many different topic areas and across many different target groups in a sense. So we're starting off with these 4, but we're hoping that as time goes on, we'll expand into other areas as well. And again, looking for suggestions there as to where we should be headed next to. So the areas that we currently are going to be commissioning work in are the work and education strand. So it's work, education, and well-being, community well-being, culture, sport, and well-being, and cross-cutting capabilities in the measurement and analysis of well-being. That last one's really about trying to tool ourselves up to be able to measure well-being most effectively, to be able to have some cross-cutting currency that we can compare all the measures, that we can compare different initiatives against, so we're sure that we're trying to compare like with like and see what changes in well-being terms, to look at things like how we do multicultural research on well-being and how best to go about that. There's a whole range of initiatives there, and also fundamentally how to translate what we're doing into something that's going to entice the Treasury into thinking about where they should be investing money in terms of what's going to have maximum benefit and how investing in these things early on can save money later on. So I think where you are, where most of your focus is going to come in the work and education evidence program. That's where we'll be looking at adult learning in greatest detail. We're looking at formal and informal learning, learning for those in and out of employment, learning for leisure and for work-related reasons. Biz is at the moment on our government, the governing board, developing the Wahlberg Centre, and they're helping to steer the focus for this particular aspect of it. So the government spends about $210 million annually on community learning, and another $20 million, we've heard with the autumn statement, has just been committed to support community learning for people with mental health challenges. So that's really welcome and exciting. But now the question is, where do you spend it for maximum benefit? And so we're hoping that the Wahlberg Centre will be able to answer some of those questions, although possibly in a slightly longer time frame than would be ideal at this moment. And we want to look at questions like which types of learning work best for whom, do the effects of adult learning last over time, and how does that work? What's the mechanism by what that works, in which that works? What types of learning work best at different stages of life among the most disadvantaged? How can learning help with transitions to work? How does parents' learning affect their children within the household? So overall, we envisage that what's going to happen next is that we will have 4 teams of academics who are commissioned by the end of March, who will take forward each evidence strand. So there'll be a collaborative team of multidisciplinary researchers, we think, for each strand of the research, and one for this work and education strand. They will actually start work in June of next year. And their first 6 months of work is going to be all about listening. It's called a collaboration phase. So from June to December, they're going to be, hopefully, getting out and about, asking lots of questions, talking to practitioners and people who deliver services and local policymakers and national policymakers, and trying to hear what your questions are, what you most want answered, what's most important to you, to be sure that that can be addressed in the work that they do in the main stage of the evidence program, and that they're addressing the kinds of issues that are most important in the real world, basically, rather than an academic focus of what might be important. They'll then gather in the evidence, and we'll be ranking it in terms of how robust and reliable the evidence is in each evidence strand, and then focus on what the best evidence available is really saying to us, and where there are gaps in our evidence that we need to fill going forward. And they'll also look at well-being impacts using a common definition. And we'll be building on the ONS Measuring National Wellbeing Program to do that. We spent the last several years developing a framework within which to look at well-being of the intervention in terms of how big an impact it's had on well-being and at what cost, and among which groups it works best. So those would be some of the questions we'd expect to answer in that toolkit. So each intervention or each piece of evidence we looked at will be assessed in those terms. And then the vision is also to work with and alongside people like you, and people delivering services, making decisions, thinking about the best way to do things. So we're not just trying to do more research. This is what the difference here is. We're trying to shorten the distance between the best evidence that's available and decision makers, the people who need to use it on a day-to-day basis. We're aiming to translate the best evidence into actionable things that people can use in their own work. And we really need to hear clearly from people like you what you want, what you'd like from the center, what would be most helpful to you, what needs to happen to move from here to that vision, of it having a sort of being part of a community focused on raising well-being, drawn together across professional boundaries, across sectors, across geographical areas. Because well-being is about the whole person. It's not, we need to join up, do something holistic, get together across our boundaries and focus more on what we all together can achieve and how we can learn from one another. So we want to create spaces where you can learn as much from each other and sharing your experiences and your expertise of what's worked or not in your own experience with others who may want to do similar things. And that might be virtual spaces online, as well as events where we get people together in this sort of setting, or master classes. And then bringing people together with experts as well, who also can tell you about the bigger picture, the latest findings, the tools that will help you to make a business case, the best way to go about your evaluation. So at the moment we're just starting out. We've got a website and we are tweeting regularly at the moment. Our Twitter account is @WhatWorksWB, if you'd like to have a look at that or get in touch with us. We also have a regular feature of Wellbeing Pioneers on our website, where we invite people to tell others about what they're doing already that they think is influencing people's well-being, how they're evaluating it, what they found out so far about how it's working. That's really to share and inspire others and to start building the community and to help you get in touch with each other as well and get back to your website, back to the things that are important to you. We also have guest blogs. We had Gus O'Donnell do a blog from a trip he's recently been on in Australia, where he's looked at well-being initiatives there and came back and told us a bit about that. The World Health Organization has gotten in touch and they'd like to do a guest blog as well. So it's not just local, it's not just UK, it's kind of global as well. And this whole move towards well-being is something we're trying to look at in the round. We also have a survey on our website under the How I Can Get Involved section. Please go and fill that in. That'd be so good, because it's really about trying to listen to you about what you'd like from the center, what would be most helpful and useful, and to get that right from the outset. So we need to know from you. And we're looking also at ways of engaging the public too, as the ultimate users of the Wellbeing Wahlberg Centre, because it's really all our own individual well-being that adds up to the whole picture. So what people can do themselves to influence their own well-being, and how we can contribute to that, and how we can put out findings that would be useful to them too. So we're hoping to have some public dialogues in the spring as well. We're also aiming to do some events in February and March where we get out and talk about how to do a well-being evaluation and making a business case. And trying really just to listen to what you have to say about that too. So we want this to be an active, engaged community of people, gathering evidence, using the best evidence possible, communicating their lessons, and sharing with each other. Please join us. Please get in touch.
Okay. Thank you.